She is a highly accomplished healthcare operations leader with extensive experience in managing global health services, international patient care, and business development. As AVP of Operations at Northwell Health, she oversees the international patient service offices, ensuring seamless coordination between patients, providers, and global stakeholders. Dr. Kubba has a background in internal medicine and a Master of Public Health, and she blends clinical expertise with strategic insight to drive innovation in international patient care. Please welcome Dr. Kubba.
Oh, wow. Good afternoon, everyone. It's really so wonderful to be here and to share the room with so many amazing women are here, and just like also with leaders who are deeply committed to women's health. So my name is Dr. Hala Kubba, and as just like a little introduction about myself and where I'm from, I'm originally from Iraq, Baghdad. I'm from the Middle East. Thank you. And I serve now the Assistant Vice President for International Patient Services Department for Northwell Health. I'm not going to take a long time telling you about Northwell, but just like for those who are not familiar with Northwell, Northwell Health is a healthcare system in New York City, and it's actually the largest healthcare system in New York City and 7th largest in the United States. We're a fully integrated healthcare system of 28 hospitals, over 1,000 ambulatory sites, and supported by an incredible team of over 100,000 team members. What we do every day, we take care of people because we share that passion. And what we treat everything. We treat just like every single patient, and we cover all specialties, starting from the simplest routine healthcare services to the highest complexity. And when I have been invited to speak today about women's health, I just like thought about it, and I picked to speak about something. Might sound really very simple. You might know about it. But I decided not to speak about anything related to medicine or clinical or diagnosis or treatment. So I wanted to speak about optimizing women's health outcome beyond the clinical encounter. Because when we speak about women's health, we naturally focus about talking and focusing on treatment and diagnosis. And trust me, I know that these are very essential and important, but they represent only one part of the journey. And me as a woman, I experienced this myself, okay? And I know that all the amazing women, just like I see right now, they share this. We take care of everybody and everything around us because how much passion we hold and how responsible we feel towards others. But when it comes to taking care of ourselves, sometimes, we fell behind and we skip it or delay the care for ourselves because we just feel obligated to take care of, our kids, our husbands, our families. We're mothers, we're sisters. So, and on top of that, we're professionals. And actually, there's a lot of factors that shape the health outcomes for women. That's not only what's going inside the clinical room, seeing the clinical expertise, it's actually what shaped factors, what happened before and after. Because we women, we don't experience health as a single episode of care. We don't just like go to a doctor and we finish and we're okay and we go. No, we experience health as a continuous journey shaped by multiple factors, but I'm going to focus on 3: access, coordination, and follow-up. And trust me, these are not administrative function. These are an outcome determinants. So let's begin talking about access. And I think the first thing comes to your mind is availability of care. No, this is not what I mean by access. I mean by access is timeliness, clarity about next step and what to expect, transparency about the cost of a treatment that I need as a woman, and how much is easy to navigate a healthcare system when I am seeking a healthcare. A recent Deloitte health survey included over 2,000 women from the United States, and actually results showed that 50% of women, they skip or delay their care. And we women, we were 35% more likely than men to skip care. The main factors and the reason behind that was long wait time, cost, transportation, childcare, because I'm sure we're mothers, you know what I mean, when it comes to me to take care of my child, I will put my child first, and I just had this conversation earlier before I present here. So we need to create a healthcare system that tackle this to make sure that women being able to continue their care. The second factor, coordination, because again, when it comes to our health, we women experience health in multiple clinical settings. We see multiple providers. We run multiple tests. I see my doctor, and then I have to do my mammogram in a different location, and then rent to other location to do blood work. So when these providers and these systems are not communicating and not speaking to each other, we suffer. And we end up forced to be our own coordinator, to repeat our story over and over, to manage logistics, to get the appointment, and also to transfer data from one place to another, and among all what's happening in our life. So I did it multiple times. Then I said, you know what? I'm going to give up. I'm going to quit. I don't have time to make this. And when I delay care, of course, the outcome suffer because I don't go to the hospital or I don't go and seek clinical care unless it's highly complex and it's emergency, which is wrong. The third factor is follow-up, because the care doesn't end when I leave the doctor's office. Continuity, it's important because community creates trust, and the trust boosts adherence and engagement. And they are just like very essential to enhancing and optimizing the health outcome. But unfortunately, follow-up is still one of the most underestimated factors to determine health outcome. In a randomized clinical trial of 360 postpartum women at risk of chronic disease, they found out that just like a very simple operational intervention of default scheduling with PCP and tailored message were able to increase their follow-up with the PCP by 19%. And they were able also to have additional screening tests and yet a better outcome. So with that being said, what's the solution? How are we gonna just like really, tackle this? And I'm gonna just like share my experience as a healthcare leader, and I got the privilege of just like also being a doctor treating patients, but also being part of process mapping and policy designing. So the solution is partnership. Partnership is the future of women's health, where we all need to partnership together, taking care of all the amazing women out there. We must build a healthcare system where clinicians, administrators, system leaders work together to design a care model that communicates well, transfer responsibility with accountability, and make access and coordination easier for women. We need a healthcare system that supports great clinicians and enable them to succeed, but we women to feel supported, engaged, and thriving while we're receiving our health care. Because when we optimize the care for our women, for us, I think we're optimizing care for everybody, for families, for communities, for generations to come, and we deserve that. We deserve this as women because we take care of everybody. So we deserve, thank you. So we deserve a healthcare system that take care of us, that provide us with a highly specialized and highly dedicated, coordinated care that keep us moving forward and going on. So I think that's it. And thank you again for having me here. And I look forward to continue the conversation and to partnership with each one of you to optimize the health for all the women. Thank you.